Good evening, everyone. Success is not a fail. Success is not a final. Failure is not a fatal. It is the courage to continue that counts. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhiraj N. Memorial Free Webinar Series organized by DIKSHA E-Learning in associate with Ayurveda College Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discuss about clinical diagnosis and management of Kushta by Dr. Keshava D.V. Sir.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class sessions, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised post in the chat box. Questions raised will be cleared at the end of the session.
Next, I would like to invite Dr. Tulya Mohandas ma'am, HOD, Department of Kaya Chikitsa, Ayurveda College Coimbatore, to deliver the welcome address. Ma'am.
Good evening, everyone. I take this privilege on behalf of Ayurveda College Coimbatore and the team of DIKSHA E-Learning to honor and welcome my senior Dr. Keshava sir in today's session. Sir is going to speak about the management and clinical diagnosis of Kushta, which is very prevalent nowadays. And from wholeheartedly, I welcome all the participants who are part of this session today. Welcome one and all. Thank you.
Thank you, ma'am.
Thank you, sir.
Thank you, sir.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Keshava D.V. Sir. Sir completed his MD AYU, Ayurveda, Mahavidyalaya, Hubbil, PhD in IPGT and RA, Gujarat, Jamnagar. Sir is currently working as an assistant professor, Department of Kaya Chikitsa in ALN Rao Ayurveda Medical College, Karnataka. We are extremely obliged to have you here, sir. Now, without any further ado, let me hand over the session to Dr. Keshava D.V. Sir to enlighten our mind with his knowledge. Over to you, sir.
Thank you. I would like to pray Dhanvantari. That is, as we know, Namami Dhanvantarim Adidevam Surasuraihi Vandita Pada Padmam Loke Jararudbhaya Mrityunashanam Dhataramesham Vividaushadinam Dhanvantarim Ramanatam Sarvaroga Nivarakam Ayurveda Pravaktaram Vande Piyushadayakam Namo Bhagavate Vasudevaya Dhanvantaraye Amruta Kalashahastaya Sarvamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha. As we know, Kushta is the disease in which we have to adopt Trivida Chikitsa. Always I used to tell one story before starting Kushta. In almost all the Hanumat Kavacha, Ramraksha Stotra, any Kavacha, etc., always they start one story I will tell. In the Purana, in Hanumat Kavacha, a shloka comes. Ekada Sukamasinam Shankaram Loka Shankaram Paprucha Parvati Bhaktya Karpura Davalam Shubham Shri Parvati Vacha Bhagavan Deva Devesha Shambho Shankara Shashwata Mahadeva Jagannatha Shiva Vishwatya Haraka Sangrame Sankate Ghore Bhuta Pretalike Vaye Dukka Davadi Santapte Bandhane Vyadi Sankule दारिद्र्ये महति प्राप्ते कुष्ठरोगज्वरे भ्रमे चातुर्थिके सन्निपाते वाते पित्ते कफे तथा शोकाकुलेषु मत्येषु केन रक्षा भवेत् ध्रुवम्. That means in Hanumat Kavacha, in the beginning, in the starting, it tells that Shiva, our Shiva, he was sitting alone in the Kailasa. Davala is white, that is in Kailasa. At that time, Parvati comes and she asks Shiva, here are Kushta, Jwara, etc. in the Bhuloka. What is the solution for this? At that time, the Shiva tells that the Hanumat Kavacha is one of the great mantra which cures Sanipata Jwara, Vidosha Vata Pitta Kafaja, Vyadis, and Kushta, any flood, etc. All those disasters, anything which can be in that particular time. If one chants this shloka, by that there will be a solution. Why I am telling this shloka means in Trivida Chikitsa, first one is Daiva Vyapashaya Chikitsa, second one is Yukti Vyapashaya Chikitsa and Sattvavajaya Chikitsa. Kushta is the disease. We have to adopt Daiva Vyapashaya Chikitsa, money, mantra, etc. At least japa, dhyana, pranayama, all those things should we have to consider alone with the medication, with our Yukti Vyapashaya Chikitsa. It is very difficult to cure because Sattvavajaya is also needed to attain Sattvavajaya. There is need of Daiva Vyapashaya Chikitsa. So we will start next Kushta definition. Start with the Kushta definition. Tvachaha kurvanti vaivaranyam dushta kushtam ushanti tat. Ashtanga Hridaya Nidanasthana explains that the disfiguration of any skin is called as Kushta. Here we have to, while dealing with the patient, we should not tell Kushta because we know what is the clinical term according to Ayurveda. Kushta means whatever the disfiguration of the skin, that is considered as Kushta. But in a common person, they know that Kushta means leprosy. So already the patient with Kushta or skin disorder, he is having depression due to this skin manifestation. We can tell Swakvikara in front of the patient, but one should not tell you are affected with Kushta. Kushta means in common term, it is a leprosy. Then second, he is explaining about Kalena upekshitam yasmat sarvam kushnati tad vapuhu. Kala is the important one. Kala we will call Kalaya tasmai namaha. Kala is the Kalohi Bhagavan. We call it as Bhagavan. The chronicity, the Kushta is a disease. If we are not treating properly in its chronicity, which causes Kushnati tad vapuhu, which affects the Sharira and which causes the disfiguration of the body. Kushta is explained under Ashtamahagada. It is a somewhat introductory class. Kushta explained under Ashtamahagada. In Charaka, Nidanasthana explains that Vata Vyadi, Apasmari, Kushti, Shofi, Tatodari, Gulmi cha, Madumehi cha, Rajayakshmi cha, Yonaraha. Here, the last line is important one. Achikitsya bhavet ete balamamsa chaye sati. Along with other Vyadis like Vata Vyadi, Shofa, Udara, Gulma, Madumeha, Kushta is also considered under Ashtamahagada. Why? The question arises, why? Because Kushta is nacha eka doshajam kinchit kushtam sam upalabhyate. Kushta is the Sanipata Jwara. It is told in Agra Aushada, it is told in Agra Sangrahani, it is told Sanipato, this Dustikityanam. Sanipata Vyadis are always difficult to treat. In Kushta Kushta is also Kushta is comes under Bahudosha Roga, Bahudosha Avastha. In Bahudosha, we have to give the Shodhana therapy. But in case of if Kushta Rogi who is having Bala Mamsa Kshaya, if the person is having Bala Mamsa Kshaya, it is very difficult to give Samshodhana. We have to give Bahusho Anurakshata Pranam. Here, meaning of Bahusho is the frequently, repeatedly we have to give the Samshodhana Chikitsa. But in case of this Kushta Vyadi, if we see the Samprapti of the Kushta, the doshas are Sira dosha, Nahi Saranashila dosha. In Visarpa, that is Saranashila doshas are there, but here with the Thirya Gata Sirad, these doshas get dislodged, this doshas lodged in a Swagadi Dhatus. Here, Sthira dosha, which are Sthiratva of the doshas are present, that is, which are stable, which are not moving, which are adherent with the Dhatus. So, it is very difficult to treat. So, Acharya has explained Kushta under Maha Gadar. Vikalpa Samprapti is very, very important in case of Kushta. Why? Because in case of Kushta, already we discussed, Nacha Kinchid Asti Kushtam Eka Dosha Prakopa Nimittham. That is, there is involvement of all three doshas. But Amsha Kalpana, that is Vataja, Pittaja, Kafaja. Even in Vataja, is it due to Shita Prakopa, Shita Guna Prakopa of Vata, or Ruksha Guna Prakopa of Vata? In case of Pitta, is it Pittaja Kushta? Is it due to Tishna Guna of the Pitta, or is it due to the Sneha Guna of the Pitta, or is it due to Ushna Guna of the Pitta? That Amsha Kalpana we have to understand. Then only we can treat the Kushta in proper manner. So there are two varieties of Chikitsa, as we know, Dosha Pratyanika Chikitsa as well as the Vyadi Pratyanika Chikitsa. In case of Kushta, always we have to concentrate towards Dosha Pratyanika Chikitsa by considering Vikalpa Samprapti. If the Vataja Kushta may be due to Ruksha Guna, then Nehana. If Vataja Kushta more probably due to Shita Guna, then we have to give the Svedana, opposite qualities. Svedana with Svedana, Sigdha Guna, like that we have to manage. So Vikalpa Samprapti holds good in case of Kushta. Then another, we move on to the Nidhana. There are two Nidhanas explained by the Acharya Chakrapani while explaining Jwara Nidhana, that is Vyadi Janaka Nidhanam and Vyati Bodhaka Nidhanam. Both are important. Vyati Janaka Nidhanam are the positive factor because Acharya Sushita explains Sankhepataha Kriya Yoge Nidhana Parivarjanam. The first line of treatment is Nidhana Parivarjana, as we know. So both Vyadi Parivarjana as well as the understanding of the different stages of diseases is important. So Vyadi Janaka Samprapti Nidhana as well as Vyadi Bodhaka Nidhana, both we have to understand. Then only we can treat the disease Kushta. This is most important one for UGs. We have to by heart this shloka, the Kushta Nidhana. In day-to-day practice also we will get some Nidhanas. Virodhi Nenna Panani Dravasnigdha Gurunicha Bhajatam Agatam Chardim Vegamscha Anyan Pratignatam Vyayamam Ati Santapam Ati Muktva Nishevanam Shitoshna Langanaharan Samam Muktva Nishevanam Karma Shrama Bhayattanam Dutam Shitambu Sevinam Ajirana Adishana Chaiva Panchakarma Apacharinam Navanna Dadi Matsyati Lavana Amla Nishevinam Masha Muraka Pishtanna Tila Kshira Kudashinam Chavayam Cha Pajirane Anne Nidram Cha Vajatam Diva Vipran Gurun Karshayatan Papam Kurvam Cha Karmam Cha Kurvatam. This is most important one by one we will go with the Nidhana. First is Virodhi Nanna Panani. What is the Viruddha Ahara? In day-to-day practice, we will get, in nowadays, due to the lifestyle, we will get these Virodhi. We are taking Virodhi Anna. What is Virodhi Anna? That is Utkleshya Doshan Na Hare Dravyam Yat Tat Samasatah Viriddham Taddi Dhatuanam Pratyani Kataya Stitam. That is, those type of Ahara, Vihara, which causes Utklesha of dosha, but which is unable to expel dosha. For example, in case of Vamana, we will give Utkleshaka Ahara like Masha, Dadi, etc. Which will cause Utkleshan of Ahara. But we are removing, after giving Vamana, we are expelling the doshas. But here, by take of Virodhi Ahara, for example, in Shastra it has given Matsya and Paya. Even in day-to-day practice, the hot pizza they are taking, pizza which is hot in nature, immediately after taking pizza, taking cold beverages, or jamun, with jamun if we are taking the ice cream, these are all fashion, become fashion. This definitely causes the Utkesha of the dosha. And intake of Dravas Snigdha Guru Ahara. And Bhajatam Agatam Chardim. That is important one. While I was studying in the MD in Hubli, sir used to ask this question. One patient came with history of Shita Pitta and Vichartika, etc. Multiple sin manifestation. Our Guru Prashant A.S. Sir, he has given so many treatment, but there was no much result. Then on digging on history, patient has given traveling history, and she has traveling sickness. She had vomiting sensation during the traveling. She definitely, whenever she gets travel, there was vomiting history. So what she did means, she has taken antiemetics like Rantac, Domperidone, etc. She used to take those medicine and then she used to travel. That is nothing but Chardi Vega Dharana. Here in Chardi Vega Dharana also Acharya has explained Kushta Rullasa Visarpa Chardi Nigrahajaha Gadaha. So always in case of Shita Pitta, Vichartika, etc., we have to ask the history, any Chardi Vega Dharana history and other Vega Dharanas also. Then Vyayamam Ati Santapam Ati Bhuktva Nishevinam. Here also, what happens in Amamata has explained, Snigdam Bhuktato Hennam Vyayama Kurvatastata. In Amamata, Acharya explained, that is, after intake of food, there will be more circulation towards GI tract. After taking food, if person doing Vyayamam or he is exposed to sun, etc., Santapam, then what happens? The circulation moves towards skeletal muscles and periphery instead of moving into the Amashriyam, etc. That leads to Ama. Along with this Ama formation, if a person indulging in Kushta Nidhana, definitely that leads to the Kushta Vyadi. So this is also we have to ask in Vyayamam, for example, in labor, in case of labor or coolie, after taking food, immediately they are doing laborious work. Definitely that in Atapa, etc., definitely which may lead to the disease like Kushta. Then Shitoshna Langanaharan Kramam Muktva Nishevinam and Garma Shama Vayartanam Drutam Shitambu Sevinam. In olden days, our parents used to tell don't take Shitambu immediately after coming back from Atapa, etc., or immediately after any work, because during, if we expose to the sun, etc., definitely there will be hyperthermia in the skin. Immediately, if you are taking Shitambu, definitely there is utkeshana of the dosha. There is, then that may lead to the diseases. Then Adhirana, Adhyashana, as we know, this is the one of the positive factor for the Hidoshakopa Panchakarma Apacharanam. This is one of the important one. Usually, patients, they will ask while taking Snehapana, can I take juice? Can I take tender coconut? We should not take, because they think juice is light and tender coconut, which are light, but definitely it is going to cause us that Sneha Ajirana. Even after Vamana, Virachana, Adi Panchakarma, one my friend, she has taken Panchakarma, Vamana, Sadyomana, as well as Snehapana and Virachana. Even after instruction, what she did, she went to Bangalore from Koppa around with the car and all. Yana is actually Nishiddha, and she did the Apatyas, and she went for the summer holiday, and she went to the Wonderla, that is Wonderla, and she selected and she did. Definitely by these apacharas, now she is suffering from Grahani. Even Grahani, Kushta, etc. This is one of the example for Panchakarma Apachara. Then Navanna, it is only explained in case of Shishir Ritu. In Shishir Ritu, as Agni is more, one can have the Navana. Except that one should not take Navanam as it is Kledakaraka. And Kapha Utkledika, Dosha Utdeshaka, one should not take Navanna. And Matsya, Tila, Lavana, etc. again, which are Abhishendi, which may cause the Kushta. And Masha Mulaka, Pistan, etc. again, which may cause the, in Agriya Sangrani it is told, Mashaha Shleshma Pitta Jananam. So definitely intake of too much of Masha definitely lead to the Shleshma Pittaja Kushta. And Mulaka also, Bala Mulaka or Ra Mulaka is Dosha Jananam, the processed Mulaka, which is Adoshalam. In Hubli, when I was studying my MD, usually there people, they will eat raw mulaka without processing it. They will eat raw. What I noticed is there are Shvitra, so many Shvitra cases and psoriasis cases in case of Hubli, North Karnataka. That may be one of the cause, as they are taking raw mulaka. Then this is also one of the important one. Vipran Gurun Darshayatam Papam Karmam Cha Kurvatam. Here, Prayachittam Prashamanam Prakatistapanam Hitam. One, while coining the Veshaja Paryaya, Acharya explains Prayachittam. Means, here I will tell one case. One Vaidya, he treated one Kushtarogi with all Shodhana, Shaman, etc. But there was no result. Then that Vaidya decided this is Papa Karmaja, maybe Papa Karmaja. Then that old Vaidya, he has taken history and he made cry. After crying, then some Shamana Aushadha, giving Shamana Aushadha, patient got the good result. That is the importance of the Papa Karma. Then some diseases like Amla Pitta, Krimi. Amla Pitta is neglect, definitely at last he is given Kandu, Mandala, Pidak, etc. Amla Pitta, the neglected Amla Pitta, if he is taking Rantak, all those things for longer time, definitely Utleshita dosha, which is there in the Kushta, which enter into the Shaka, which may lead to the Kushtadi Vyadis. Samprapti, as we know, there is the Hidosha Kopa, there will be Yugapat, simultaneous Vikruti Apta Sidosha, and Sogadi Chatvara Dhatus get Shitilata, then there will be Kushta. Here already I explained, Stira doshas are present. The doshas are settled in the Gambhira Dhatus. No Saranashilata of the doshas. That is, there is no moving doshas. The Stira doshas are there in the case of Kushta. Sapta Kodravya Sangraha, as we know, Vata Pitta Kapha as well as Swagrakta and Mamsu, all are involved in case of Kushta. So already we discussed, we have to assess the Vikalpa Samprapti. Vayu, Pitta, Kapha, what are the gunas which affect the Kushta Rogi. Kushta Bheda, already we know, I am not going in detail. Kapala, Udumbara, Mandala, Vrishya Jiva, all those things we know. Shudra Kushta, 11, we know. These are some pictures here. We can in first picture, we can see that there is dryness in the skin as well as blackish discoloration. That is due to Vata Kushta, Vata Pradhana Kushta. In case of this picture, here there is a crust formation which is having whitish discoloration.
Excuse me, sir. Sir, you're muted, sir. Can you please unmute yourself, sir? We cannot hear you, sir.
Am I audible now?
Yes, sir.
Yes, sir, you're audible, sir.
Am I audible?
Hello, sir. Yes, sir, you're audible, sir. Sir, could you please unmute yourself, sir? We cannot hear you, sir. Hello, sir.
Am I audible now? Am I audible?
Yes, sir. Yes, sir, you're audible, sir.
Okay. Moving towards Chikitsa. As we know, Vatottareshu Sarpihi Shamanam Shreshmottoreshu Vamanam Shreshmottoreshu Kushteshu Pittottoreshu Moksho Raptasya Virechanam. This is famous quotation as we know. What happens when patient came with the skin vyadi? Actually, we planned for Virechana. We have given Vrutapana. Even by taking Vrutapana itself, patient got 90% of the release. As I told importance of Amshamsha Kalpana in the beginning, here what we have to understand, Upashaya and Anupashaya, by intake of Vrutapana itself, patient got relief means that is Vatottara Kushta. Then we must give a little bit of Mrudu Virechana only we have to give. Then what happened? One case, Avastha is very, very important in case of treating Kushta. What happened? One patient came with psoriasis. The scaly silvery lesions were there all over the body. Especially, patient has itching, and she has the lesions were more in the upper part of the body. Patient was shy in nature and she afraid of Vamana. Even though we told Vamana, we have given Virechana and Shamana. By giving Shamana and due to the Virechana, what happened? The symptoms are flared up. This is due to, actually that was the disease was Kafaja, but we have given Virechana, that is the treatment of Pitta. Then what we did, Vamana, again after due course of time, Vamana, Virechana, etc. What we did, Vamana, Virechana and Tifala and Manjista, Vidanga Kashaya Dhara, then we got the marked relief. This is the importance of Shodhana Chikitsa according to Avastha. Instead of giving Vamana in Kapha Roga, if we are giving Virechana, the Utkleshita dosha, which should be expelled with the nearer route, that is the mouth, that is through the vamana, we are unable to expel that Utkleshita dosha. That
Excuse me,
definitely.
sir. Sir, I'm sorry to interrupt, sir, but your screen is not shared, sir. The
Not shared,
slides are not visible. Yes, sir. The slides are not visible, sir.
Am I audible now?
Yes, sir. You're audible, sir. Your screen is visible, sir. Thank you, sir.
Is it okay? Thank you.
Thank you, sir.
As I was telling, the patient came with psoriasis. The female patient, she had lesions all over the body, especially in the upper part of the body. We even after convincing, she was not ready to take the vamanam. Then what we have to do? Then we were we were given virechana and shamana. By that, what happened? The symptoms flared up. This is maybe the Utkleshita dosha, especially kapha dosha, that should be taken out by the nearer route, that is by the vamana. But in this patient, we tried virechana. The Utkleshita doshas we are unable to expel out. So the symptoms flared up. After due course of time, after vamana and virechana, then there was marked relief. Then another case, patient came with already diagnosed as lichen planus. Here I marked it is from 15 days. Kala Prakarsha, as I told, is important one. Only this was a fresh case. Immediately after Lakshana, patient came to Ayurveda. Then what we did, Virechana with the Mahatiktaka Grutam, Snehapana with the Mahatiktaka Grutam, then Virechana with the Tirutlehem, and patient was given Shamanoshidi, the Shonitamrata Kashayam of the Kotakal, and Gandhaka Rasayanam granule, or 21 Avartita of the same Kotakal, and Aditya Paka Taila for application. And patient told to, after application of Aditya Paka Taila, expose the affected part in morning sun, in Atapa Sevana, morning Atapa Sevana it is told. And as Rasayanartha, after due course of time, Madhusnuhi Rasayana was given. As I told, the patient came immediately after, when she got the signs and symptoms within 15 days. Now after I think 10 years back it happened, because this is nothing but my mother only. As she has taken treatment immediately after what symptoms. Usually what happens, patients with skin disorders, they will take steroids, all anti-inflammatory disease drugs, etc. At last they will come to the Ayurveda treatment. At that particular time, these doshas which settle in Gambhira Dhatus, and treatment is become very difficult. And another case with psoriasis, again Kala Prakasha is important. Within 30 days of signs and symptoms, she came to our hospital. We have given Virechana. After Deepana Pasana, we have adopted Mahatikta Virutama as Snehapana and Trivrut for Virechana, and Patavalo Katarunyadi Kashayam, Gandhakarasayana, Arogivardhini Vati, and 777 oil. That is again Aditya Paka Tailam. for due course of time. Then again we have given Tiktaka Ghrutam in Shamana dose. This is the story of 5 years back. Now also within one Virechana and with the treatment of 3 months, usually psoriasis is reoccurrence of psoriasis more, but in this case there is no salient symptom till now. Then move on to the different Kashaya Kalpanas in Kushta. Mahatiktaka Kashayam or Tiktaka Kashayam, which is given in case of Pittaja Kushta, especially so many Kashayas told. According to Amshamsha Kalpana, according to different diagnosing dosha pratyanika chikitsa, this Pittaja Kushta we can give Mahatiktaka Kashayam. The patient is having burning sensation with itching or Thanustrava. Ghanastrava is always oozing with thick discharge, is always kapham, whereas Thanustrava, that is oozing, mild oozing, thin oozing, then that is considered as always pitta. So Patola Katarunyadi Kashayam, which is Kapha Pitta Haram, Aragvadadi Kashayam, again Kapha Haram mainly, Mahamanjishtadi Vata Pitta Haram, Ugulu Tiktaka Kashayam, again Kapha Haram, and Trayantikadi Kashayam, which is Dushi Visha Haram, and Nimbadi Kashayam in case of Yavana Pidaka or in case of abscess and all we can give. Asanadi Kashayam, even it is mentioned in the Prameha, this also in case of abscesses and all, Idridi and all, we can give. If patient of Kushta along with Prameha, one can go for Asanadi Kashaya also. Varunadi Kashayam, if in case of Vidrudi, and Rasna Panchaka Kashayam or Rasna Saptaka Kashayam, which is given in case of psoriatic arthritis, etc. Then concept of Nitya Virechana. As Bhudosha and if patient is Abala, Nitya Virechana is indicated. For example, Manibhadra Guda can be given, and Trifala Churnam, Vipattikara Churnam in case of Pittaja Kushta, Ritiki Churnam in case of Kafaja Kushta. Gruta Prayoga, Gugulutiktaka Grutam can be given, but when giving Gugulutiktaka Grutam, it is as it consists of Gugulu as well as Ballataka, one should not give in case of Pittaja Kushta. And Tiktaka Gruta, Mahatiktaka Gruta, which is well indicated in case of Pittaja Vyadi, and Aragvada Mahatiktaka Grutam, Kadiradi Grutam. Kadiradi Grutam is best Rechaka, and Varunadi Grutam already we discussed, which is given in case of Kapha Medo Kushta. Then Guguru Kalpana, Panchatikta Gruta Gugulu, which is important one, and one should have in clinic, because Panchatikta Gruta Gugulu is especially it is Kushtagna Grantihara is best Rasayana also. So one should have Panchatikta Gruta Gugulu, and it is best in case of psoriasis also. Panchatikta Gruta Gugulu, especially in case of cracks in the food, that is Vipadika, Plamo, plantar psoriasis. Kaishor Gugulu, which is indicated in case of Pittaja Kushta, Amritadi Gugulu also, Vatarakta, Pittaja Kushta, etc. Swayambhuva Gugulu, which is mentioned in case of Shvitra. This is one of the important Gugulu which is having Rogadikara with the Shvitra, as it consists of Aval Guja, that is the Bakuchi. And Rasaushadi, Rasamanikya, which can be Rasamanikya in smaller dose can be added in the Kashaya, and then we can give around 1 gram of Rasamanikya can be added in Kashaya. Rasamanikya is Kapha Vatahara, especially Kledahara. Even some capsules like Puritin, which is having Rasamanikya, which is best in case of kapha, kandu, etc. And Gandhaka Rasayana, Arogyavardhini Vati, Chandraprabha, even Chandraprabha, which is mentioned in Mutravaha, Roga, and Prameha, in Falashruti it is given. In Kushta also we can go with the Chandraprabha Vati. And Taila, Mahamaricadi Taila, again, in case of Pittaja, one should not give Mahamaricadi Taila because it consists of Haratala, Manashila, Shigru, etc. Tishna Ushada, especially Maricha, which is Pitta Karaka. And Karanja Taila, which is mentioned in Visarpa, Yesti Taila also in case of Pittaja Vyadi, Chakramarda Taila, which is mentioned in case of Dadru Kushta, especially in the fungal origin disorders, and Nalapamara, the Keram or Taila, and Nimba Taila, which is especially in case of Vrana, etc. Aditya Paka Taila, already I explained in case of psoriasis, 777 all or Vetpalai Taila, which comes under Aditya Paka Taila. Here, 3 Kutaja is used. And Pinda Taila, even Pinda Taila we can give in case of Vipadika, which is best in case of Vipadika, even in the burning sensation, etc. And move on to the Parisheka. Panchavalkala Parisheka can be given as a Bahya Parimarjan Tikitsa in case of Pittaja Kushta, Aragvadadi Parisheka we can give in case of Kafaja Kushta, even Trifala Parisheka can be given, Nimba Parisheka, etc. in case of Puya, Kafa, etc. Manjishta and Yesti Parisheka given in case of Pittaja Kushta. We can add Tankana Basma in case of Tankana Basma, Shanka Basma, Zarsakarpura Jala or Tutta Jala, Shuddha. These Tankana Basma, Shanka Basma, Rasakarpura, Tutta, which are Tishna and Lekhana in nature, which can be added in, which can be given as Tankana Jala we can use for Parisheka, or we can add Tankana Basma in Panchavalkala, Aragvadadi, Kwata, etc. Shuddha Gairika, Gomutra also we can use in case of different Vyadis like Gomutra in case of Kapha, Puya, Shuddha Gairika in case of Pittaja Vyadi. And Duma, Nirgundi, Vidanga, Gugulu, Tashapa, Haridra, Jikatu, Sutta, Tulsi. All these we can use for Dhuma as it is Kanduhara, Krumigna, Puyahara, etc. In case of Kledajanya, Tokvikara, we can use Dhupanam. And Lepanam, Kandakadya Malaharam, Sajjarasa Malaharam, Mahatiktaka, Vrutalepam, Vipadika Malaharam, Shatadauta Grutam in case of Pitta, even Bilvadi Gulika, which is taken for Lepanam in Dusi Visha, any insect bite, etc. Even Bilvadi Gulika, which is taken as Shamana Ushadi internally. And Jivantyadi Emekam in case of Sputana, Panipada, Sputana, Vipadika, etc. And Aravada Patra and Nimba Patra can be used as Lepanam in case of Katina, Thira, Kushta. And Asavarishta in case of Pittaja Vyadi, one can go for Karivadhyasava, Kadirarishtam, especially in case of Kafaja, Panchatikta Kada again in Pitta Kafaja, and Manjistadi Kada in case of Pitta Vataja. With this, we can conclude that we have to assess Dushyam Desham, Balam Kalam, Analam Prakatim Vayaha, Stum Satnam, Tata Aharam. All we have to consider. Plus, we have to adopt Prati Purusha Siddhanta. Purusham Vikshya Tagneyo Vishavuttama. The best physician is one who considers Prati Purusha Siddhanta. Even though Vikyartika may be there in two different rogi, but we have to assess is in Vichechika which dosha is it Vata Kapha, even though Kapha Pradhanata is told, sometimes there may be Vata Pitta or Vata Kapha, like that. We have to assess the Sati Purusha Siddhanta, and according to Nidhana only we have to treat. Thank you.
Thank you, sir. Sir, shall we move on to the question and answer session, sir?
Okay.
So can you hear me, sir? Sir, can we
Yes,
move
yes,
on to the question and answer session, sir? Okay, sir.
Yes, yes, I'm hearing.
Sir,
Yes,
the first question is,
yes, we can.
sir, in which condition Gandhaka Rasayana and Rasamanikya and Arogyavardhini should be given?
Okay. Arogyavardhini, it is Rasagandhaka Lohabra Shulva Basma Samamshakam, it is told. What?
Sorry, sir. Hello,
Am
sir.
I audible now?
Yes, sir. You're audible.
Am I audible?
Sir. You're audible,
Namaste.
sir.
Okay, okay. What was the question? Yes, yes, okay. What was the question? Arogyavardhini Vati, where we have to use?
Yes, sir. What they've asked about, sir, in which condition shall we use
Rasamanikya.
Rasamanikya and Arogyavardhini Rasa, sir?
Actually, Rasamanikya, which is consists of Haratala. So it is Kledahara and Kapahara Kunduhara. Whereas Rasamanikya is Tishna in nature, one should not use in case of Pittaja Vyadis. Only in case of some Srava is there, oozing is there, or Kandu is there. In such condition, Rasamanikya can be useful with minimal dose. That also very, very important, because Haratala, the arsenic, is the content of the Rasamanikya. We can add 1 gram of Rasamanikya. We can add the 1 gram of Rasamanikya in Aragvada Kashayam, etc. Then daily we have to shake proper, because the sedimentation of the Rasamanikya may be there in at the last. It may overdose at the last. So daily we can have the Rasamanikya along with the Kashaya, 1 gram of Rasamanikya. But it should not be given in case of Pittaja Vyadis, as it consists of Haratala. And Arogyavardhini Vati, Rasagandhaka, already I told, Rasagandhaka Loha Abra Shulva Vasma Samamshakam, and it is having all the Rasaushadis, all the Rasabhasmas, as well as Buggulu and Kotukarahuni, etc., which can be given in case of Vata and especially Kaphaja Vyadis. One should not give in case of Pittaja Vyadis. Gandhaka Rasayana, in almost all disease we can, especially Pitta, Kapahara, even which is indicated in hair loss also, which is Kesha also. Any other question?
Thank you, sir. There is another question, sir. Sir, what is the indication of Kaishora Buggulu, sir? Yes, sir. Sir, there is another question, sir. Sir, can I read it, sir? Hello, sir.
Kaishora Buggulu. Kaishora Buggulu, which is having Danti, Dravanti, Guduchi, etc., which is some sort of Nitya Virechaka, which is indicated in case of Vatarakta as well as the Pitta Pradhana Kushta, even Pitta Pradhana Yavana Pidaka. Like that we can go for Paishwar Guggulu. Paishwar Guggulu is the Pittahara Guggulu. It can be given in case of even in Vatarakta or even in the Kushta, which is dominant with Pittaja.
Thank you, sir.
Any other question?
Sir, there is another question, sir. What is the treatment for Kunagha, sir?
Okay. Removal of Kunaka. If it is more affected, removal of the Nakha is the treatment of Kunaka. Otherwise, if it is in the initial phase, we can go with the, we have to clean with the, this one, what I told, Rasakarpura Jala or with the Tankana Jala, etc. And Ropana Dravyas like Nimba, Rajani, etc. we can apply over that.
Thank you, sir. So there is another question, sir. Sir, what is the advice for Visarpa, sir?
Okay.
What is the treatment and advice for Visarpa, sir?
What?
What is the treatment and advice for Visarpa?
Can you repeat the
sir?
question?
Yes, sir. So they've asked, oh, what is the application and advice for Visarpa?
In case of Visarpa, for application, usually we will give Shatadauta Gruta because Shatadauta Gruta, which is we will wash the Gruta with the Panchavalka, which is Shita Virya. If the Visarpa, which is having burning sensation and all, one can go for Shatadauta Gruta for application, and internally, especially according to the more according to the Lakshana we have to give, if burning sensation is there, then Tiktaka Kashaya should be given, or Sarivadhyasa we can give, or Kamaduga Rasa we can give, or Argyavardhini, what you told, that can be given, and Nitya Virachanartha one should give Katuki or Vipattikara Chudra. That is depending upon our yukti. And as Rasayana, one can go for Madhusnuhi Rasayana. In case of Kushta, the famous Rasayana is the Madhusnuhi Rasayana.
Thank you, sir. So there is another question, sir. Sir, what is the treatment of fungal infestation, sir? Fungal infection, sir?
Okay, in case of fungal infection, again, what I told, the wash with the Tankana Jalam, then different combinations like some lotions in market it is coming, like D-Sora lotion, we can go with the D-Sora lotion, and different soap like Siddharthaka soap, so many things are coming that can be used. And in Kashaya, Guguru Tiktaka Kashayam, which is best in case of this fungal infection like tinea, etc. And Rakta Prasadartha, one should give Kadirarishta, all those things. But maintaining of hygiene is important in case of fungal infection. In the case of fungal infection, one should take long treatment. That is important. And Nidana Parivarjana like Dadi, Matsya, etc. This is also one should follow. Otherwise, it is very difficult to treat the fungal infection. Hygiene is also very, very important in case of fungal infection.
Thank you, sir. Sir, there is another question, sir. Sir, which Rasaushadhis are used in clinical practice in Pittaja conditions, sir?
Okay. in Pittaja condition, Pichu Rastaushadi.
Yes, sir. Yes, sir.
We can use Pittaja in case of Pittaja condition, burning sensation is there. So usually we will give Kamaduga rasa or Chandrakala rasa. Chandrakala rasa is the one of the best Daha Hara. Along with other medications like Tiktaka Kashaya, etc., we can give this Chandrakala rasa or this Kamaduga rasa or Lagu Suta Shekara rasa or Suta Shekara rasa also we can use.
Thank you, sir. So shall I move on to the next question, sir? So the next question is that what will be the dosage and duration of Tiktaka Krida and Mishraga Sneha and Sammanna Sneha, sir? So shall I repeat the question, sir?
What?
Sir, there is another question. What will be
Can
the
you repeat
dosage?
it?
Yes, sir. I'll repeat, sir. What will be the dosage and duration of Tiktaka Grida and Mishraga Snehas and Sammanna Snehas, sir?
Mishraka Sneha is the Sneha which is given for Mrudu Virechanartha. Here, Taila Gruta, both are there. So, again, this is depend upon Agni, and this is, we cannot standardize. This is the dose. According to Agni, according to the avastha of the disease, we can fix. Up to 5 to 15 ml or gram, we can fix Mishraka Sneha. Tiktaka Gruta up to 5 to 10 ml. Again, it is depends upon the Vaya, Kala, etc. Agni also important one. Only after Agni Sandushana and with this one Kushta Shuddhi. Only after Kushta Shuddhi one can go for Tiktaka Gruta. At least Sadhya Virechana we have to give. After giving Sadhya Virechana, how to give in OPD level? That is, we can give the Taila according to the disease for Abhyanga at least for 2 days. After Abhyanga, one can take a warm hot water bath. After hot water bath, one can drink the hot water, Ushnodaka, and Guru Pravarana he should do. The blanket, he should cover the whole body with the blanket. After that, he can go for Virechana, Sadhya Virechana with the Trivrat with the quantity of 10 to 15 gram or 20 gram according to his Kushta. Then only one should go for Snehapana, that is Grutapana, Tiktaka Gruta or Mishraka Sneha, etc. Because if you are taking in Ashuddha Kushta, definitely it will increase the disease. So only after Kushta Shuddhi, at least with the Sadhya Virechana, one can go for treatment. Grutapana.
Thank you, sir. Sir, the other question is that what is the treatment for dandruff, sir?
Dandruff.
Yes, sir. They've asked that, sir.
Actually, the Keshava D.V Sputana Darunaka is about dandruff. Especially the common remedies are Dastura Patradi, Thailam we will use, and for shampoo we can use Karfol. The attribute company has got over the shampoo that is Karfol. Definitely it has good action over dandruff. And Snehapana also important in case of this dandruff, because Kesha Sputana is the dryness of the Kesha Bhumi plus some dravyas like Triphala, ST, Kesha dravyas we can along with this one hibiscus we can use for hair condition, etc.
Thank you, sir. Sir, the next question is that, sir, what is the advice for measles and chickenpox, sir? Sir, what is the advice for measles and chickenpox, sir?
As it is in case of measles and chickenpox, it is again the viral disease, and there will be pitta pradhanata. There is the pitta pradhanata in case of these disorders. One can give Sarivadhyasava, Manjishtadi, Kashayam, and after due course of time, one can have the bath with Nimba, Vasa, etc. And Arogyavardhini Vati for healing the for healing of the measles, etc. One can give. And Nitya Shodhana is important here with the Katuki and Avipattikara Churna, etc. And after due course of time, one can give the Taila like Karanja Taila, ST Taila, etc. according to the condition.
Thank you, sir. So the next question is that, sir, for chronic Dadru cases, which is not cured by allopathic medicines, what will be the effective management, sir? Chronic Dadru case, sir, which is not cured by allopathic medicines, sir. What is the effective management plan, sir?
You're telling definitely as it is the chronic, definitely there is a need of panchakarma, at least virechana, and as already I told, the medicines like the Gugul Tiktaka Kashayam or Bilvadi Gulikam, as it is the Dushi Visha Hara, that should be given along with the external applications like nowadays so many drugs are coming like Fungvin by Siddha medicine. The Fungvin is one of the good choice of the in case of fungal infection like Dadru, and the external application Parimarjana Chikitsa, that is Marjana Chikitsa by the Tankana Jala, Rasakarpura Jala, etc. And trichoderm, the use of trichoderm, which consists of Nimba, etc. There is which is from the company Atrimid, which is also useful in cutis by the Vasu. The ointment cutis from the company like Vasu, and some lotions like Jackman lotion and D-Sora lotion. All those are useful in case of this Dadru Kushta.
Thank you so much, sir.
And washing with the Gomutra added with the Tankana Basma, etc. But we have to assess the dosha. If it is in Dadru Kushta. Okay.
Thank you, sir. Sir, the next question is that, sir,
Okay,
spider veins on legs, sir. The next question is that there is spider veins on legs, sir. What is the advice for what is the advice and for layup of medicine, sir? Shall I repeat the
Lepa.
questions? Yes, sir.
What is the question?
Sir, they've asked that there is spider veins on the legs, sir. What will be the advice and labor
Can you
of
repeat the
medicines?
question?
Sir, there are spider veins on legs, sir. Sir, what is the labor of medicine, sir?
Okay. In such condition, one can go with the Gairika Lepa and Gandhakadya Malahar is not that much effective. In such condition, one can go with the Lepa of the Gairika, Nimba, etc. Gairika is as Pitta Hara and which is mixed with Pinda Taila. Definitely it works nicely.
Thank you, sir. So they've asked, the next question is that, sir, what is the treatment for acne, sir? Hello, sir.
In case of acne,
Yes, sir.
again we have to assess is itching is there, burning, dosha pradhanata you have to assess. Accordingly, you have to treat. And what you have seen is the Jalavkavacharana is also one of the best treatment in case of acne. And some lepas like Kunkumadi lepam. Again, you have to assess the dosha. Some the patent medicine like A-Clear, ointment, A-Clear, Clarina of Himalaya, etc. And removal of the and lepa with Kantaki Karanja. Sorry, Salmali Kantaka is also best in case of acne. And Nimba Kashaya, if the persists, Nimbadi Kashaya, Nimbadi Gugulu, etc., which are beneficial in case of acne. After the due course of Vamana is also beneficial in case of, as it is Urdhva Bhaga, affected part is Urdhva Bhaga, Vamana followed by Sadhya Virechana, then Jalavkavacharana, then Shamanaushadhi like Kaishor Gugulu, etc., which is beneficial in case of this one, Pidaka, Yavana Pidaka.
Thank you, sir. So the next question is that, so what is the general Shodhana and Shamana and labor for Spitra in skin condition, sir, in clinical practice, sir?
In case of Shvitra.
Yes, sir.
Shvitra.
Yes, sir. SWITRA, sir.
Can you repeat the question?
Sir, what is the general Shodhana, Shamana and labor?
Shvitra. Okay. Lepa in case of Shvitra. Okay. In case of Shvitra, definitely again Vachansi Tathyani Kritagna Bhava. It is according to first itself, Acharya explains about the Papa Karma is the one of the positive factors for the
in
Shvitra.
in
So,
clinical practice.
first
So the
Devapashya Chikitsa we have to adopt. Along with that, definitely Vamana Virechana. Shvitra. I'm not hearing. You're not audible. In case of Shvitra, for Lepanartha, Avalbujadi Lepa, that is Bhakvati Churna and Manashila, which is added with Gomutra, which should be applied over only affected part. If we only affected part, then there will be formation of blister. There will be formation, there is a formation of blister. After formation of the blister, one should rupture the blister with the any needle. Then already I told the Bhrungaraja Sava as well as Swayambhu Guru, which are best in case of Shvitra. Even repeated Shodhana is necessary in case of Shvitra, and Prachanna Karma and Jalauka Charana. All those we can adopt in case of Shvitra to remove the local doshas.
Thank you, sir. Thank you so much, sir. Delegates can post their questions in the chat box. Delegates, please post your questions if you have any further queries to ask to sir. Sir, they have asked Gandhaka Rasayana dose and precautions while using. Is there any side effects, sir? Sir?
Usually, it is a process with so many drugs like Bhrungaraja, Triphala, etc. Usually, which has not side effect, but in some persons, those who are allergic towards sulfur, in such person which may cause adverse reaction. So, one should take care in those persons who are allergic towards Gandhaka Rasayana. Otherwise, it is good. One should take this medicine along with Anupana of the Gandhaka Rasayana is the milk. If a side effect is there, then one should take the milk.
Thank you, sir. Sir, the next question is that, so for dandruff you told about Snehapana, sir. Please explain how we can give it, sir.
Not in all case. Snehapana, which is indicated only if it is Vatajanya, if Keshabhumi Putana is there due to excessive prakop of Vata. Not in all cases, all cases. You have to assess the, as I told, Amshamsha Kalpana of the Nidhana, Lakshana, etc. we have to do. If it is due to Vata Kopa, then only Shamananga Sneha, not Shodhananga, Shamananga Sneha can be given. Not in all the case. That to depend upon Vatajanya. In even Dharunaka also, Vatajanya, Pittajanya, Kapajanya, like that we can assess. If it Dharunaka is there with itching, then Kapha. With Dharunaka along with Rukshata of the hair, then Vata. Then if burning sensation is there and some allergic skin manifestation, which may be due to Pitta, like that we have to assess.
Thank you, sir. Sir, the next question is that, kindly explain ichthyosis treatment, sir.
Again, it is compared with Eka Kushta. Here, we have to do the Bahiriparimarjana Chikitsa is ichthyosis. As I told, it is Vataja Kushta, Eka Kushta it is. And so, Snehapana with Vatahara Gruta is indicated here as Shamananga Vatattereshu Sarpi it is told. So, one should give Shamananga Sarpi as well as the application of Gruta, Taila, etc. Yamaka, Jivantyadi, Yamaka, etc. which is beneficial in case of ichthyosis. Even Rakta Prasadaka Dravyas like Thariva, etc. is also beneficial in case of ichthyosis.
Thank you, sir. Sir, the next question is that what is the treatment for urticarial rashes, sir?
Again, we have to see the chronicity in case of urticaria or Shita Pitta. One patient came, she was Anganwadi Karyakarta. I think in 10 years back, she has taken Vamana, followed by, even she was thin lady, but we thought maybe the dosha, maybe the kapha. Then we adopted Vamana for her, administered Vamana. After Vamana, Sadhya Virechana we have given. Then Shamana. Again, after due course of time, Vamana, Sadhya Vamana and Sadhya Virechana, like that we have given. Then the Shita Pitta Hara Dravyas, like especially in Shita Pitta, Katu Taila it is mentioned. Katu Taila is the Sarshapa Taila. One should give the Katu Taila for application. Then Shita Pitta Hara Dravyas, like Sarivadhya Sava and Tiktaka Kashaya, Patola Katurunyadi Tiktarechaka Kashaya, etc. Am I audible?
Yes, sir, you're audible, sir.
Am I audible?
Yes, sir, you're audible, sir. Sir, I can hear you, sir.
Okay. Like Pittarechaka Kwaka of Pentacare, which is okay. Pittarechaka Kwaka of Pentacare, which is nothing but Patola Katurunyadi Kashaya and Mahamanjishtadi Kashaya, which are useful in case of Shita Pitta. Even application of Yashtimadu Thaila, etc., which are beneficial in case of Shita Pitta. Nitya Virechana is also important in case of the concept of Nitya Virechana is also important in case of Shita Pitta.
Thank you so much, sir. Sir, there are no more questions, sir. Shall we conclude the discussion session, sir? Sir, shall we conclude this question and answer session, sir?
Sir?
Okay.
Sir, can we conclude this discussion session, sir?
Yes, yes, ma'am.
Thank you so much, sir. That was an extremely informative session, sir. And thank you for patiently answering all the questions, sir. Thank you so much, sir.
Okay, ma'am. Okay.
Now we'll move on to the vote of thanks, sir.
Thank you very much, sir. Now, I invite Dr. Neetu ma'am, Assistant Professor.
Thank you. I'm thankful to. Okay. I'm thankful to Tulya, especially Dr. Tulya.
Thank you very much, sir. Now, I would like to invite Dr. Neetu ma'am, Assistant Professor, Department of Kaya Chikitsa, Ayurveda College, Coimbatore, to deliver the vote of thanks. Ma'am.
Thank you, Soumya. Good evening, sir. Good evening, one and all. On behalf of Ayurveda College, Coimbatore, and Team DIKSHA, it is a privilege and a great joy for me to extend a vote of thanks for today's session. And the speaker is none other than my own guru, my own sir, from A.L. Rao, sir, The best teachers are those who show you where to look, but don't tell you what to see. And the sir is one among them, and the best guru we had in our college. And I would like to express my sincere gratitude to Dr. Keshava sir for sharing your valuable experience and views on Kushta and its diagnosis and management. And sir shared many of his clinical experiences with us. At every point of the session, he tried to engage us with many clinical points. Thank you, sir. Thank you so much for this wonderful session. And sir was always patient with his students like us, and sir had patiently answered all the queries which was raised by the delegates. Thank you once again, sir, for enlightening us with this knowledge. Thank you. Thank you so much, sir.
Thank you, ma'am. Work for a cause, not for applause. Live your life to express, not to impress. Thank you all for patiently listening and for the valuable time to spend. See you all in the next session. To know more about our updates, please do stay connected with our social media platform. Today's all for the today's most interesting session with lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining with us. Thank you.